Hello ladies, I'm here with Dr. Helen Witchier from True. We're here discussing vagina issues, and we've had a lot of questions from you all in the community. So today we're going to discuss a few of those questions and talk to you about certain issues that we have.
Sure.
Yeah. So I think we're just going to dive straight into the deep end of the question here. What does a normal vagina look like?
I think everyone wants to know, are they normal?
Yeah.
Like we've said before, we're all individuals, everyone looks different.
Yeah.
It's important to know too that lots of people say vagina when they're really meaning the vulva, which is the external, or the part that you can see.
Yes.
The vagina is the internal part.
Yeah.
Sometimes people are comparing themselves to images that they might see in the media or in magazines. And remember, those images have all been photoshopped. So it is hard to know what other real women look like. I often use a resource called the Labia Library.
Okay.
It's an online resource showing real pictures of vulvas and shows the wide range and variation in normal that we have as women.
And there certainly is such a wide range, isn't there?
Oh, absolutely.
I remember seeing a beautiful painting by a famous artist, and she actually painted all the different types of looking vaginas, and I'll tell you what, they all looked so different.
Yes, yeah.
Yeah. Is it normal to have problems with your vagina?
Lots of people have concerns. Sometimes people are concerned about normal and natural functions of the vagina, but other things like infections or bacterial changes are quite common.
Some women experience issues after pregnancy. For example, what treatment options are there for a prolapse, and who do you see about that?
Yeah, so lots of women are concerned about feelings of prolapse or trouble with their bladder or bowel after pregnancy. So again, a good GP is the first place to start, finding a GP who's got a special interest in women's health, and they can assess the pelvic floor, advise on pelvic floor muscle exercises. The other great resource are physios who are specialists in women's health or pelvic floor and continence issues, and they can really help design exercises to strengthen the pelvic floor and help women regain any tone that might have been lost during that process of pregnancy and childbirth. The other expert care is available through gynecologists as well.
Explain what a prolapse is, would you mind?
So a prolapse is when there's a looseness or a laxity in the vaginal walls, and that people might feel that the tissue that's supporting the bladder or the bowel starts to come down into the vagina as well.
Okay.
So they might notice a heavy feeling or a dragging sensation or feeling uncomfortable by the end of the day.
Does a prolapse result in bladderal or bowel problems?
It can. So sometimes that changes in the tissue can affect the front vaginal wall, and that can affect the bladder, or the back wall, and that can affect the rectum. So often people will have some urinary incontinence as a result of that prolapse. And bowel issues can happen as well. They're probably not as common as bladder.
Some women experience recurring pain just before, during or after sex. Why is this, and what can be done?
That's a big question. There's a whole range of things that can affect the pelvic floor, the vaginal and vulval skin, and even sometimes the internal organs. So that can be things like a change in hormone levels after childbirth or with menopause. That drop in estrogen can result in vaginal dryness and soreness that way, or perhaps something like an ovarian cyst might cause internal discomfort. So pain with sex is not normal, and would really suggest, if people are experiencing that they talk to someone who understands the importance of getting it sorted out and can investigate and manage them appropriately. So
don't let that drag on. You really need to see a GP.
No, don't just put up with pain with sex.
What can women do to help with vaginal dryness?
So commonly that's due to those hormonal changes. It can be due to lowered estrogen, after having a baby or while breastfeeding, or in the perimenopause or menopause time. Often it's safe to add back a little bit of estrogen to the vagina in the form of a cream or a little tiny tablet that dissolves in the vagina. So that can get those hormone levels back up again and make sex more comfortable, or stop those feelings of dryness. Otherwise, using plenty of lubricant with sex. It sounds very obvious, but lots of people are really hesitant to do that, and it's very safe, easy and effective to do. And then there's also some vaginal moisture retaining gels that are available through the pharmacy, and they can be really useful too.
Yeah. Another about lubricants. Is there any natural type lubricants you could use as well?
Yeah, you can use simple things like vegetable-based oils.
Wow.
So, plain olive oil or sweet almond oil are safe to use on the skin.
Okay.
Just be cautious if you're using them with condoms. Water-based lubricants are probably safer with those.
Yeah, okay. A few women have asked about dry skin itching. What causes it and what can they do about it?
The skin around the vulva and vagina can be affected by conditions like dermatitis or psoriasis, just in the same way as the skin on the rest of your body.
Yeah.
So having an accurate diagnosis for what the problem is probably the important first step.
Yeah. Yeah.
Otherwise, general vulva and vagina skin care, so not using harsh soaps or things that are really frothy and bubbly, they can really dry your skin out. Using simple moisturisers, avoiding too many products because that changes the pH balance and the bacterial balance of the vagina and sometimes makes things worse in the cycle rather than making them better. Yeah,
those bar soaps aren't the best to use, are they?
So they can be quite harsh, but the other things that can be quite harsh chemically are the nice foamy, bubbly washes. They've got lots of perfumes, they've got lots of foaming agents. So washing with plain water is best, but if you need to use something using a non-soap wash that's specially designed for sensitive skin.
Okay. What is thrush and what can we do to prevent it?
Thrush is a really common fungal infection that can occur.
Especially up here in the tropics?
Absolutely. The warm, moist environment.
Yeah,
it can really leave some people very prone to it. Some people seem to get it a lot. Other people might only get it once or twice in their life, if at all. So trying to reduce that hot, humid microclimate as much as possible, wearing cotton clothes, not staying in lycra gym wear or swimwear for too long if you can help it. Trying to wear things that are loose and allowing airflow.
Cotton.
Absolutely.
And changing if you need to.
Yes.
Especially here in tropical North Queensland, you may need to change, at the end of the day or a couple of times a day at lunchtime or whatever. So don't feel bad about that because it's normal, especially in the heat, What causes vaginal discharge?
It's normal to have vaginal discharge. So in a woman who's ovulating, going through a normal cycle, she should notice a change in her discharge from day to day throughout the month. So it's normal for it to be different around the time of ovulation than it is just before she has a period.
Yeah.
Other causes for discharge can be some period issues. Maybe people might get some spotting in between or after periods, and that might need to get checked out. Other common causes can be thrush or bacterial vaginosis, which is a change in the normal bacteria that live in the vagina.
Yeah, right. So there's a few different things there that could cause that.
That's right. There's a number of things that can cause it.
And so again, it's worthwhile going and seeing a GP if it,
That's right. If it's happening recurrently or it's there and it hangs around for more than a week or two. Yep.
Yeah. Now this is the uncomfortable one. Why is sometimes there's a smell with the vagina, and what causes that?
I see lots of women who are really embarrassed about a vaginal odour. It's normal for the vagina to have some smell. It's when it changes from the usual that people are concerned. The most common reason is that condition called bacterial vaginosis.
Okay.
So that's where the normal bacteria in the vagina have one sort outgrow or overgrow the others. And that changes the pH levels and it does result in an unusual odour. So that can easily be treated. It's good to get a correct diagnosis. Sometimes people think it's thrush and they treat for that, and that's not actually going to fix the problem.
Yeah, right.
So again, seeing someone who can give you a proper diagnosis and using some simple either tablet treatment or cream treatment can resolve that issue quite quickly.
And is that caused from moisture? Too much moisture?
We don't really know why it happens in some people. It's more common when women are first with a new partner. It's more common when they're having more sex than usual. And that seems to be that change in the vaginal pH with the secretions there.
Yeah.
And some women just seem to be prone to recurrent episodes. So we've got different techniques and strategies that we can use to help them reduce the number of times that they have issues.
So what can women do to keep their vagina healthy and normal?
Yeah, that's a great question. I think people do want to stay healthy.
Yeah.
the vagina really is self-cleaning.
Yep.
So you don't have to do too much to try and keep it clean. Washing with plain water or a very mild non-soap cleanser is all that you need to do.
Okay.
You know, as far as possible, avoid using other creams, lotions, powders, oils, those sorts of things in the vagina.
Yeah. I think, I don't know what your thoughts are on this, but also teaching our girls when they're wiping to wipe from the front to the back too.
Yep, that's really important. And I think, you know, mums can pass on that information to their daughters. It's important that we use the right names for body parts so that girls are familiar with their own anatomy and they know what's where and what's normal and how to look after. No, I don't.
Woo-woo or fluffy or none of those names?
I think if you're using the terms like vulva and vagina, then it's clear, you know, everyone knows what you mean, and girls have got that clear language to talk about themselves and about their bodies without being embarrassed or ashamed about it.
Yeah, it's a normal part of our body, and thank you, Helen. That was great. Again, got some really good insight there. And so guys, tune in to true.org.au and read some more information there. If you have any questions or comments, pop them below, and stay tuned for some more episodes. Thanks guys, see you next time, bye.